A risk assessment is an integral part of the management of health and safety in the workplace. In simple terms, a risk assessment requires the identification of workplace hazards and an evaluation of the risks they present. It is therefore crucial to understand the difference between a hazard and a risk. A hazard is anything that has the potential to cause an accident, injury, illness, or disease. A risk is the likelihood that a specific hazard will actually result in an accident, injury, illness, or disease occurring. More simply, a hazard is the potential for an unplanned and unwanted event, and a risk is the likelihood the event will occur. Many hazards, which are generally seen as potentially very dangerous, actually present a low level of risk in some situations. For instance, electricity is a potentially dangerous energy source, but in an office environment is generally seen as safe. Conversely, many hazards that are sometimes considered insignificant often lead to accidents and injuries, the most common example being the hazards associated with manual handling tasks. The purpose of an overall workplace risk assessment is to establish whether the level of risk arising from workplace activities is acceptable, or whether additional measures need to be taken to control workplace hazards and further reduce or remove unacceptable risks. To conduct a risk assessment of the workplace, certain steps should be followed.